our webinar. And I'm going to invite Angela Rooney from Cigna just to say a few words to open, and then we'll get started with our panelists.
Thank you,
Angela.
Thank you, Marianne. Thank you so much. Great idea putting the words up. So how am I feeling? I'm feeling quite okay, Marianne. It's Fridays, but I am tired. So I've seen a few words in there as well, and challenged. But it's actually really nice. I was thinking, yeah, my goodness, you know, you're at home, right? We're all at home, but it's so nice to be connected virtually to the external world. So, I mean, that's also a very positive message. So thank you so much, Marianne, and everybody at Bond for organizing this event. It's an actual pleasure to be connected again with Bond and the partnership we have with Cigna and Bond. So it's the first of 3, and we'll have 2 more in 2021. Unfortunately, I'm expecting it's going to be virtual. I don't see us coming out of this sort of cloud we're in at the moment too quickly in 2021, but we will remain on the same topic. It's going to be well-being and staff care. So 2021, again, we'll see each other probably in this format with the videos. And I suppose one of the things I want to say, it's always a pleasure for Cigna to share what we are doing. And Robin, who you see on video right now, will be speaking a little bit later in the session. And I hope that we can share our change management and what we're doing for our staff. And possibly there'll be some aspects of that that people can take into their policies going into 2021. And vice versa. I mean, it's really interesting for Cigna as well to learn from organizations in your sector and what you're doing, because you have the biggest challenge, right? You've got people, a diverse population, you've got people in remote areas and volatile situations. So I'm really looking forward to the session. Thank you all for joining, because I mean, you know, it's December, it's nearly Christmas, you're all busy. We've seen what's come up on the, you know, how are you feeling? So let's cross our fingers you can get something for your own leadership. Thank you so much, Marianne. Thank you.
Thanks, Angela. And so this webinar is entitled Staff Wellbeing in Remote and Humanitarian Contexts. And we've got 4 wonderful panelists for you today. And shortly they're all going to just introduce themselves to you. But before we do that, I just want to say a bit about how this platform works. So if while people are talking, we're going to have hear from each panelist in the first half of the webinar. They were going to share something about the work they're doing in their organisation and the kind of support they're providing to staff and the way that they're dealing with wellbeing in humanitarian contexts. And as they're talking, you're welcome to put questions in the Q&A. So you should see the Q&A at the bottom of your screen, and you can just post a question in there while they're talking. We might come to that question when they finish speaking, but mostly we'll just come to clarifying questions at that point, because what we're going to do after we've heard from each of the panelists, we're going to take a short break and then we're going to come back and have a discussion. And we're going to, at that point, have some more interactive questions for you and ways that you can engage with the panelists, and we'll answer broader questions at that point. But feel free to be putting them in the Q&A as we go, just so that we can then I can then be, you know, managing those and making sure that we get to them at some point during this 2-hour session. This session's being recorded, so that's for you to know, and also to know that you'll be able to watch it back, and so would others in your organisation. And yeah, I think that's all of the housekeeping that we need to do to start with. So without further ado, I'm going to invite each of the panelists just to share who they are, where they work, and briefly either how they're doing today or something about how they support their own well-being. I'm going to go first, Julia.
Yes. Hi, thanks for having me on, and hello to everybody on the call. It's great to be here. So my name's Julia Warrington. I work for Save the Children International, and I'm currently the wellness advisor to our global humanitarian surge platform. A bit of background about myself: I've worked for Save the Children for 15 years, initially at Save the Children UK, where I sort of managed and nurtured our surge team there for about 12 years. And then since 2019, since the beginning of 2019, I became the wellness advisor to our newly created global Surge platform, which actually brought together all the different little pockets of Surge staff that were held by different parts of the organization. We brought it all together under one platform to reduce sort of duplication of roles, reduce costs, increase consistency of delivery, of efficiency, all of that stuff anyway. So yeah, we gathered all our Surge staff together under this one platform, and I became the wellness advisor to our humanitarian staff. So I support our humanitarian team, who, as we all know, have lots of either acute or chronic stresses in their life as a result of their role. One of the things I do, I'm going to say what I do to support my own well-being, actually. I know that humanitarian work, it's such a deeply held value led employment choice that, I think I've seen people over all the time I've worked at Save the Children, people put in so much of themselves into their role that it's often very hard for them to switch off. So switching off, I think, is a really key part of being able to be efficient in the long term, and to maintain your own well-being. So something I've learned to do is to be quite strict with work-life boundaries, to be able to switch off and to stop thinking about work at the end of the day. Not always easy, and of course, if there's a massive crisis, that doesn't quite cut it. But generally, when things are going quite smoothly, yeah, I'm quite strict with how I regulate my time and I make time to relax. So that's it for me for now.
Great, thanks, Julia. Welcome. Lana, would you like to just share who you are?
Hi, everyone, and thank you so much again for having me as part of this great platform. So my name is Lana Bqaiyan. I'm probably the only one coming from the Middle East here on this call. I'm the staff care specialist working with the International Rescue Committee, and basically responsible for the Middle East and North Africa region. As a staff care specialist, I work as part of the Duty of Care program, which I'll talk a little bit more about during the session. It's a program that's dedicated to staff welfare and well-being in the IRC. I am currently based in Jordan. I've been working with the IRC for 2 years now. Previously, I was in the human resources field for almost 10 years, and I've always been interested in the psychology and the culture and behaviors and well-being in the organizations. I'm doing good today, and I will also share one of the things that really helped me, and I do agree with Julia on the importance of recovering and trying to, because of the type of our work in the humanitarian aid is very draining and consuming, it's really important to incorporate during these times of not having control over what's happening, to have some control over what we do on a daily basis. By what I do is I have at least 30 minutes or 1 hour a day, 1 hour each day for myself, for if I want to read, write, exercise, meditate, whatever I can do just to make sure that I feel anchored and ready to start the day. So, and relax as well. So yeah, this is it. Thank you so much. Over to you.
Thanks, Lana. Jodie, go ahead.
Thanks, Marianne. Hi to everyone. Thank you as well for having me here today. So my name is Jodie Gunn-Russell, and I'm an HR advisor for CAFOD, which is the Catholic Agency for Overseas Development. So the last, say, 3 years, I've had a specific role on projects, and one of them has been looking at wellbeing for our staff. So we have offices based in, well, here where I am in London, and we have offices in Africa, across various countries, and Cambodia with our staff there as well. So I also coordinate an informal network group called the NGO Staff Wellbeing Network, which is a group of people across the international development sector who meet with an interest in wellbeing. We meet about every six weeks just to share learning. And yeah, I was going to share as well a bit about what I do to look after my well-being. And I think like both Julia and Lana like to take a bit of time to separate work from other things. I have surprised myself over this this particular year, got quite into cooking. So sometimes I like to spend just an afternoon cooking and baking, which I quite enjoy. So that's me.
Okay, thanks, Jodie. Over to you, Robin.
Hi, thanks. Sorry, I was struggling with Zoom for a minute, and my apologies because I got kicked off the platform just a minute ago. So let's hope that's not going to happen again. Hi, I'm Robin. Really excited to be part of this discussion today. So a bit about me. I lead the HR teams in Cigna International Markets. I particularly focus in the teams across Europe, across the Middle East, and a number of other locations too, globally. So some really interesting stuff going on there that we're going to talk a little bit about later on. What an interesting and challenging and difficult year for everybody. And from a personal point of view, I mean, I'm interested, of course, professionally in how organizations work, how individuals contribute, and the well-being of individuals, the well-being of teams, and the sort of health of organizations generally. I work as a coach as well as my sort of HR role in order to keep myself focused, not just in terms of my sort of professional role. I always make sure I've got somebody I can use as a sounding board. I think that's kind of really critical. I had the most ridiculous travel schedule before the crisis sort of hit this year. The big benefit to me this year, which has enormously helped my own personal well-being, has been able to actually spend quality time with my family, which I really haven't been able to do for quite some years. So that's the benefit for me. Thanks,
Robin. Thanks, Robin. It's great to hear from you all some of what you do to support your own well-being. And I think we're going to hear shortly from Julia a bit about how Save and in Save the Children have been thinking maybe a bit differently about well-being since COVID hit, and I'm sure that theme is going to come up a lot this morning. But I first met Julia before COVID hit, and the bit as part of a project I've been working on with the CHS Alliance around wellbeing in humanitarian organizations. And the thing that I remember about Julia was her kind of fierce enthusiasm for making a difference in terms of staff wellbeing in the humanitarian sector. So I'm really excited to hear her share a bit more about the journey of this year at Save, and so welcome, Julia.
Thank you very much. Yeah, I guess I just want to share some sort of general thoughts really about the past year, about our model, the Global Humanitarian Search Platform, and our approach to staff care there, because it's something that we considered when we set up that platform. And we had, a wonderful opportunity because we set it up from scratch. So we didn't inherit any operating model. We could start from a blank piece of paper basically, and put down what we thought would be really helpful to build a resilient surge team. A couple of things about that. So underpinning everything that we did was this understanding, and I think this is really key, that wellness and staff well-being is a cross-cutting issue that affects every part of an organization. It's definitely not a standalone policy. That is one thing I know for sure. That will not work. It's not an add-on. It's not something that you can just sort of pop into the mix and go, yeah, we've got our staff well-being sorted. It doesn't work like that. It's a cross-cutting issue. So for me, I visualize it as a thread that goes through every stage of the recruitment cycle, how we manage our staff, how we support them when they're having individual or personal issues or work issues going on. And then now thinking about the policies that we put into place, and the focus from our platform point of view, has always been to be people-centric. And I think what I mean when I talk about that is that we think about our policies in terms of how they support the staff member, rather than having a policy for the organization that just works for them and shoehorning people into that policy. It's a bit more subtle than that, and of course it's a two-way street. The policies have to work for the organization as well, but I think in the past there has sometimes been a focus on the organizational side of things rather than the staff position within the organization. So that was a really key part of how our platform has been set up, and that kind of underpins a lot of the other things that I might talk about as we go on through this conversation. Anyway, so I will talk more about how the platform has and that approach has supported our ability to get through this year. You know, it's been tremendously challenging. I mean, COVID has pretty much turned everything about international travel, delivery of aid on its head. You know, people have not been able to get on planes. I mean, even within, you know, African countries and travel between countries, there have been restrictions. And if it's not travel and flight restrictions, then it might be quarantine, stuff like that, that really slows deployments down. So as a platform on supplying, you know, humanitarian responders, that was incredibly challenging for us. So what did we do? Well, we had to adapt really quickly. And I think I'm linking the well-being and our approach to staff well-being to the fact that we were agile and our staff were able to flex really, really quickly. With, I think, having talked to them, and I talk to all our staff very regularly, you know, with a sort of minimum disruption to their well-being. I think, you know, they've already felt supported. We have policies in place that support them. We've sort of gone the extra mile in making sure that all the challenges, and there are many challenges that remotely supporting programs and responses throw up, and I can talk a lot more about that perhaps a bit later on. But, you know, the fact that people aren't traveling, they're working from home, dealing with their own family issues and worries about COVID, on top of, you know, difficult working environments and you know, having to homeschool children, everything else, you know, that's thrown up a lot of well-being challenges. But we've been able to adapt because I think we already had in place a solid well-being structure for our staff. So that was key too. A little bit about localization and Black Lives Matter, because I think this is really, really important as well. And it's something that COVID seems to have really catalyzed some thinking about the pace of localization. I mean, I was reading a blog by Hugo Slim very recently, and you know, the localization, we're not doing very well at it in the international aid community. We're not going fast enough. The funding isn't getting localized really. You know, capacity isn't getting localized quickly enough across the organization, across the sector. And I think that's acknowledged, and we need to do better. So COVID and the Black Lives Matter, you know, that has really focused our thinking about some of the perhaps outdated, slightly colonialized delivery of aid. It's really made us think as a sector, as a whole, I would hope, that we need to do much better. And what are we doing as an organization, Save the Children, and in particular, you know, my sphere of influence, which is the global Surge platform, you know, what are we doing to support that? Well, we were slightly derailed in 2020 in our plans for localization, but 2021 is absolutely our primary focus. And this is to move from a model where we've got roughly at the moment 45 internationally employed, so employed by the platform ourselves, who are 45 humanitarian responders who are 100% dedicated to humanitarian responses. That's their entire focus, that's their whole role. Well, we're moving, and we want to move to get to about 200 national staff who are trained, supported, capacity built, rigorously tested, and with the right skills and you know, profiles and stuff, but have them locally based and funded, with a funding model that is built into our platform, which rewards their country office employers for allowing them to go from their full-time role into a response role for a number of months a year. And it also rewards that individual as well, so they get an increase in their salary. So I think it's important to mention funding, you know, national localization requires investment, and we need to be honest about that. And it requires investment not only, I think, in enabling local offices to free up staff, but also to reward those staff for, you know, doing a really tricky job. And then, of course, if, again, going back to the wellness aspect of this, so, you know, what does localization mean in terms of staff well-being? I think for me, this is, you know, this is a learning year for us. But one thing I do know is that well-being is definitely going to be different for different groups of staff. So what works, you know, for a white Western person is definitely not going to be the same for, you know, somebody in DRC. So I think we need to make sure that the provision of well-being support to our staff pays very close attention to their, not only to their personal identities, but to their traditions, their cultures, their environment, things like gender as well. Of course, that goes without saying. So, you know, I think we'll be learning as we go along about what works. I think we would like their well-being support of localized staff, humanitarian staff, to really reflect their own culture and traditions, but of course maintain a consistency as well across the provision. So how am I doing for time, Marianne? I don't want to, I've got one or two other things.
Yeah, go ahead. You've got like a minute or two.
I've got 1 minute, right. Well, in that case, that's great, because I can summarize really quickly on these things I have learned, and we have learned as a platform, as an organization. So there's some fundamental principles, I think, that apply across all people, all cultures and stuff. And this is what I've found that works for our staff. The first one is knowing, get to know your staff really, really well. Know about them, be curious about their, you know, their personal, their background, the environment, and their identity, you know, within reason, of course. We don't want to be, you know, going into too much detail with people if they're not happy to share, but knowing about them builds trust. And if you know about your staff, then you can build, you know, you can be flexible with them about what they're doing. If, you know, if they've recently had a baby or whatever, or become a parent, you know, we would, we'll adapt their deployments around that and make space for that. And I think this, what I'm getting at is being flexible with staff. If you know your staff and they know you and are happy, and there's this bond between you that you can really, it provides a lot of strength, I think, in that employee relationship, and a lot of strength and a lot of trust as well, which is really important when you've got people working in really complex, difficult environments. So it also enables you to support them properly and in a way that's appropriate for them too. I think that's it. I think I better stop there. I could go on, but I'll leave it there for now. I think I've said enough. So that's my overview.
Thanks, Julia. Actually, we have had one question, which is about, you know, what insights and trends have come out of the pandemic. And I think, you know, you've highlighted some, and maybe we'll hold that question to later, because I think we might all have some additional answers and discussion around that later on. So thanks so much, Julia. We're going to move to Lana. at IRC. I know that I have also met Lana through the work I've been doing with CHS Alliance, and I know that I've been really impressed to hear about some of what IRC have been doing around wellbeing for their staff, and also about the specifics of what you've been offering in the Middle East. So welcome, Lana.
Thank you, Marianne. And again, thanks so much for organizing this amazing platform. And yes, we did have a conversation before about what we've been doing at IRC in general and what we've been learning during this year and what we had already in place before the pandemic started, and how we kind of adapted our approach to be able to respond to the new needs that came out with this pandemic. And I mean, it's very obvious that COVID-19 has basically caused a disruption to our working and personal life in general. And it did introduce anxieties, new stressors, the part of the uncertainty that I think most of us, I would say, share that part of. We feel that things might be outside of our control. We're uncertain of what's going to happen next. So this uncertainty by itself adds to the stressors that we, as even working in the humanitarian aid, where we face unique stressors when trying to support our beneficiaries and the people that we serve, is also having the pandemic with that has also added to this stress. Today I'm going to talk a little bit very briefly about the duty of care program that we have in place and how we adapted to the COVID-19, and a little bit of the Middle East and North Africa, and how some of the support we did contextualize somehow to kind of address specific needs that come out in our context. So at the IRC, the Duty of Care program is basically a cross-cutting program that started 3 years ago. And the initiation of the program obviously came because there was a need. And this need is, I mean, working in the humanitarian aid and serving our beneficiaries and people who suffer from conflict or in crisis areas is a great cause. And sometimes we put a lot as aid workers from ourselves into this work. And it is really important for organizations to, in order to maintain a healthy employees, and in order to optimize the support that they provide for our beneficiaries, is to support staff well-being in the process. And I believe that IRC and obviously other organizations are giving more attention and focus to well-being during these times. So in the Duty of Care program, we have a major area that we focus on, and it did work well and was well received from our staff, which is we have an employee assistance and resilience program at IRC, which basically offers counseling to our staff and their family members. So staff have access to free and confidential counseling services wherever they are. Before, we did have the in-person option. Now, because of the pandemic, we did have the remote option, and we do have that also now. So it's very convenient for staff to reach out to this type of services. Under the same program, we do have manager-specific consultations where managers can also reach out for support. And another branch of this program is also providing customized service planning, self-care planning for our staff. So these services that we promote and we offer to the IRC staff members and their family members through the Duty of Care program are all free. And although sometimes we think, okay, this is great, but in parallel to that, I do believe that, and I think IRC also noticed the importance of the education and raising awareness of destigmatizing the psychosocial support in general, and the importance of taking care of ourselves in order to be able to take care of others in this field. The importance of psychosocial topics that we might live on, like that become part of our life in general, in the working life, and also in the humanitarian aid context, because staff are very prone to burnout if they don't really dedicate the time, if they're not supported by their organization. So in parallel to the counseling services that are offered, we work on providing our staff with trainings on how to build resilience. We have a training for managers on staff care for managers, how managers can take care of themselves, and at the same time how they can support their staff. So and a lot of other resources that I know we don't have all the time to speak about everything right now, but we do have a system in place. We do have resources in place. We built a public webpage for our staff to incorporate all the resources, the support resources, linkages to outside high quality content resources. We created the specific content for COVID-19 under the Duty of Care website, where staff can have easy access to resources. It can be from the WHO, from CDC, trusted guidance. And we have developed at IRC as well guidances that are specifically to support psychological and well-being and maintaining resilience during the pandemic, whether you're in self-isolation, whether you're overseas away from your family, wherever you are, we try to tackle every situation or circumstance that staff might be in the IRC in general. So previously we did get the chance to have the interaction, field visits, be there, provide self-care sessions for staff in the field. But now we had, because of the COVID-19, of course, we needed to adapt to the new, to a new approach, which is one of the things that we found helpful, and there was a higher demand on that, is the support that opens a platform for staff to connect and get the information that can help them also cope and support themselves. And so we initiated in Duty of Care globally a webinar series that focuses on coping and maintaining resilience during COVID-19. And it's a regular webinar series that we had the first round, and then after doing surveys, it was obviously helpful for staff, and they requested that they need more of this kind of support. So the webinar series are still on. Through these webinars, topics like loneliness and isolation during the pandemic, for instance, are covered, and how staff can take care of themselves when they're self-isolating. Topics around gender well-being and the pandemic were also covered, and some other topics in each area. So these webinars have been helpful. Another thing that was also, we noticed that had been helpful during this time, also a kind of more focused platform, is providing group support sessions for staff. So back to the webinars. Webinars are provided by counselors who have background. It's through our partner, and they have background in emergency response and humanitarian aid, like the context and everything. So they are specialized people who provide specialized response and open space where people can share their experiences, whether in webinars or group sessions, group support sessions. And it's, I think, because now people, maybe it's the time where people feel this need for connection, and which might come a long way when people feel they have this platform where they share their common experiences and get advice, and they share what worked well for them, we noticed has really been helpful for staff. And we also use these platforms to remind staff about the counseling and psychosocial support services that are available to them. I'm not sure if I still have time, but I do have a couple of other points that I wanted to say. If I do,
I think you have like a couple of minutes. And I just wanted to bring, there's a couple of questions coming up, and we'll get to them in more detail later, but some of the focus of them is around how you make support services culturally appropriate. And I just wondered, maybe, I don't know if that was part of what the 2 points were going to be, but if you could just speak briefly to how you specifically when you're working in the Middle East, because I know you work across IRC, but also then specifically in the Middle East, if there's some things that have come up that might be useful for people to hear.
Yes, thank you. This is a great question. So of course, the Middle East and North Africa is a quite different context, because here, unfortunately, we're a conflict area, and so a lot of our staff who provide support for beneficiaries were themselves at one point beneficiaries as well, and they were impacted by this conflict. So here we have some specific needs when we're talking about people who might already be traumatized of the conflict. I'm talking about staff members who were in the past 2 years that I've been working with IRC. We've had staff who were internally displaced inside Syria. We had critical incidents inside Libya. We've had, of course, the explosion that happened in Beirut or in Lebanon. So we're a conflict area, with always heightened insecurities. So we try to bring a more contextualized support in that line. Like what we did, for instance, we did a webinar session for our staff in Libya that talks about coping during the pandemic in light of the Libya context, because there in Libya, people are struggling already, and now they have the health systems are not the best in each country. So stressors are really, there are real struggles there. So, and people are not demanding. You notice that whenever there's a lot of need, people are not demanding. Whatever you give them, whatever you offer, just to make them feel that they're valued, they're heard, they're supported, can come a really long way. We've noticed that during these couple of years. And staff do really appreciate, I believe in general, not only in the Middle East, the importance of feeling that they're respected, they're valued, the organization puts their well-being as a priority during these times. Also here we have some gender-specific challenges that I know gender equality is a topic worldwide, but it might have a different taste here in the Middle East as well. And we did provide, we did create specific resources like a webinar to discuss the challenges of gender in the Middle East in light of the pandemic, and how can you cope and how can you maintain resilience and during these times. So these were some of the things that were specific to the Middle East, of course, and the way that we work here. Another thing that also came out in the support, school closures, for instance, here in Jordan, we have working parents who have to attend to home learning and working from home at the same time, as well as other competing demands. So it's really important for leaders. The important role of leadership and managers is really now more important than ever, for leaders to be visible, to support their staff, to provide this flexibility and acknowledge and recognize that working workloads and people might not be at their optimal mental capacity or physical or whatever, to be able to provide the same work or quality or whatever of work that they did before. So it's really important to have this communication, transparent, empathetic, to have compassionate leaders that can really make staff feel that they're supported by their organization. So one of the things that also we did here is we did specific group sessions for working parents in the Middle East, and basically a small platform where parents come together with a counselor and they can share their experiences and get tips on how they can manage.
Lana, I'm going to bring you to, just because we're at the top of the time, I want us to hear from the other two before the break. And so that's really, no, it's fine, it's fine. I think that some of the other things that you have, we can come to in the panel discussion.
Yes.
We have lots of time for discussion.
Yeah.
So
yes.
Thank you
Thank you so much for reminding me.
Yeah, no, you're welcome. You're welcome.
Thank you.
So Jodie, welcome.
Thanks. Okay, shall I get started?
Yes, sorry, yes.
Yeah, that's cool. Okay, thank you, Marianne, and I've been really interested in what Julia and Lana have said so far. And yeah, today I'd just like to share with you some wellbeing practices that we've put in place in CAFOD over the lockdown and COVID periods, and how we've been looking to support staff. I'm also just going to include a little bit about what I've learned through the process, about what we feel has kind of worked well and what hasn't worked well. So I know that there's a wide range of people here with different experiences and knowledge around staff wellbeing, so I hope that you find some of this useful. In order to round down what I was going to share today, I'm mainly going to be focusing on our practices around mental health, which has been a big focus in this year for us. So if you just go to the next slide, I've just got a few visuals. It's not lots of wording, so just have a little reminders there. So firstly, one of our mental health commitments in CAFOD is that we'll train managers to spot the signs of staff who might be having mental health, psychological or emotional difficulties. So this includes that kind of preventative action of the importance of creating a positive workplace environment and building relationships. I think, like Julia said, knowing your staff is so important, and knowing when they are withdrawing or perhaps acting out of character. And if there are warning signs lasting over 2 weeks, really, then this is a trigger for concern, and then that manager can talk to that person or get support from our support channels as appropriate. So generally we cover this for all new managers, and we do refreshers, but during this COVID time we've offered some extra wellbeing sessions for all staff, which has included this concept of recognizing the signs of stress in each other, and we know that this is harder during times of remote working, and that actually more effort needs to be made around when us just being aware when people are struggling. So if you go to the next slide, please, thank you. So mental health awareness has been a key focus of our wellbeing kind of practices this year. And over the last few years, we've had a Mental Health Awareness Week in CAFOD. This year, rather than just have one or two of us plan this week, we decided to set up a working group of about 12 people across the organisation, across teams and locations. And the result was that we came up with and kind of voted on topics that were felt to be most relevant for staff. So we ended up with 4 sessions that were open online to all staff. So and these were led on by external health providers. So one was mental health awareness in general. Another was dealing with anxiety. So that was voted as being very relevant at this time of kind of COVID, and there's so much uncertainty, especially at the beginning, but perhaps now as well, really, and supporting others' mental health. And a 4th one was just a fun social with a quiz to just lighten things up a bit. So my reflections from the Mental Health Awareness Week was that actually really having a working group to help input into some of these wellbeing practices can really help that we ensure we cover topics that are most relevant for staff. And that the people in the working group as well will naturally help communicate to other staff and engage people from across locations and contexts. And through feedback from the sessions, I learned that people really appreciated simply discovering that it's normal to be feeling anxious over this period. That was one thing. And I also just kind of discovered or reinforced that in CAFOD, and I think across the sector, we have a real range of knowledge about mental health. Some people would like the chance to go a bit deeper into this topic in the sessions and trainings. Others are really just getting to grips with what the term mental health is. And so that's a real challenge that I'm kind of reflecting on for next year, and how do we work to the different places that people are. Later in the year, actually last month, we also offered another couple of sessions. And this was due to popular demand that we had done last year. So being a Catholic organisation, we did a couple of sessions on how prayer and spirituality can help deal with stress and uncertainty. And again, this was met with a lot of positive feedback. And my reflection on that is just remembering that there's real value in holding sessions and having wellbeing practices that align to our values and our culture. So just bearing that in mind. And one more practice I was going to mention around mental health awareness was that we have a mental health support network of a group of 10 people who are mental health first aiders, who've been trained to, they're not professional counsellors, but they've been trained to listen to someone who may be in crisis and signpost them towards further support. So these are all CAFOD staff. And what's been a challenge is that the last couple of years at first, the people who were trained were all based in London. And this year we trained 3 more people who were based across different locations. They were all very enthusiastic when they came after the training and took it upon themselves to present their learning back to the teams where they were. And it's still a work in progress. So now we have one in Birmingham, one in Liverpool, and one in Nairobi. But they are taking that out and talking about that message of things like looking for signs when someone isn't coping. And we hope to spread that further next year. So if I could have the next slide. I know that Julia and Lana have mentioned this already about the importance of flexibility, and I think that's something that's really come through this year, particularly around the need for work-life balance, so that people can work the hours that work for them, and while juggling all these other things such as caring responsibilities. At the start of COVID, the situation, we reviewed our benefits and we added 5 extra paid days for time off for personal reasons. And we also communicated that, you can, as is possible, you can decide to do your working hours when it works for you, to dip in and dip out of the work. So as time went on, things went back to business as usual a bit more, but the decision by leadership remained that allowed for this informal flexibility of working, choosing your hours during the day when possible. But sometimes we did hear people say things like, oh, I would love to be able to take a longer lunch hour sometimes and make up the time, with the kind of impression that perhaps it wasn't something culturally that they would do in that team, or they didn't realize that they could do that. So that was quite interesting for us about our way of communicating that and how we might do that more effectively. So at the same time, I was reaching out to some external networks and asking what other organisations in the sector were doing around supporting staff. And I learned that some other organisations were introducing ways of working kind of agreement. For example, it might be based on feedback they'd received about how we can be kinder to ourselves whilst working remotely. That might mean blocking out 30 minutes over lunch break, or avoiding booking over lunchtime where possible. So I thought this was a fantastic idea, and I took this to our leadership team, and we decided that at this time it would be best to create a tool like this that departments and locations can use to create their own ways of working, so that it can apply to the different contexts that people are in. So teams so far have chosen things like, be able to take a 2-hour lunch break and make up the time, or one has no Zoom calls on a Friday. I quite like that. So I think the learning from that was really that sometimes saying things like we allow flexibility isn't always enough. It's about the way we communicate and the way that we role model these things. How am I doing for time? I have one more short point and then
you have like 2 minutes.
Okay, thank you. Yeah, so that's fine. I think that's great. Could I have the next slide, please? Just a short one on mentoring and coaching. I won't say too much about this, other than we reviewed our mentoring offer and coaching offer this year, and have matched a number of mentors with mentees, and it's great to have been able to do that online across distances, and I think the new kind of focus on technology has really helped allow these things to happen. And we're also piloting a group coaching cohort. So perhaps it might not be directly about well-being, but there's a lot out there about the well-being benefits of growth and development. So we're going to be evaluating this in March, and it'd be interesting to see how many of the participants feel that this has had an impact on their well-being as well. The last thing I was just going to say with the next slide, please, is just to share that so I was saying earlier that I coordinate a staff wellbeing network, and these are some of the different topics that we've been discussing, and sometimes having speakers on since April, really. So this I think this gives an insight into what some organizations in the sector are really keen to discuss, and what are relevant topics at the moment. So I thought I'd share. And yes, if you want to know more about the network, you're very welcome to join, and I can always put my email address in the chat. That's me finished, Marianne.
Thanks so much, Jodie. And actually, I had also wanted to say that, yeah, the Staff Wellbeing Network, which is a great space for talking with other practitioners, particularly HR people who are really interested in wellbeing and promoting wellbeing in the humanitarian sector. And maybe can put a link in the chat or your email, or whichever's easiest. Yeah, great.
Yeah, thanks
so much. So we're going to come over to Robin now, our final panelist for today. So Robin's the Global HR Director at Cigna, and I think he's going to pick up on some of the themes from the others. So welcome, Robin.
Thanks, Marianne. And what a great set of themes. And I really want to just echo what Jodie's just been saying there about coaching and mentoring. What an incredibly important skill set, in effect, for managers and organizations to have. I think there's a couple of slides that I just wanted to share, and I'm not going to talk to the detail of these because I think it's the conversation and the sort of themes that are probably much more important here. Well, what an incredible year this has been for everybody, hasn't it? And we've really accelerated. I mean, I think it personally and across Cigna that we've been able to really accelerate the shift from relating to colleagues as employees to relating human to human. And I think that this has come across in a number of the comments and the themes talked about so far today. Just on this first slide, and I just wanted to focus back on, and we've already talked about this a bit about in terms of mental health and sort of stress and anxiety issues. I've been an HR professional for a number of years, probably about 25 years or so. I've had more conversations about mental health in the last month than I've had in my entire career as an HR guy. And that's quite frightening, really. And that just shows the extent of the change that we're going through. And it shows the extent of the crisis that we're having not just globally, and you guys are at the absolute sort of forefront of humanitarian aid and sort of crisis management. I believe we're facing a crisis from an organizational point of view in how we support and how we work with and how we relate and how we really empathize with our teams. And I mean, this is pretty clear, isn't it? This year, it's about isolation. It's about concern around, do I have a job longer term? It's about, am I going to get sick? People, my family and loved ones, how am I going to care for them? All of that uncertainty. So what a difficult year that everybody's involved in and in the middle of. Just moving on to the next slide. What impact has that got on how we work and how we connect? And I think that this is pretty critical, isn't it? Because I think as leaders and as managers and as HR professionals, we have to really deeply reflect on what it is we're doing. And of course, at Cigna, you know, we are, as an organization, we're supporting organizations globally in terms of well-being, health and wellness, resilience. We're doing a lot of work with multiple organizations globally across all of the different regions. But equally, and I think my primary concern here and what I wanted to share with you today is, what are we doing to support our own staff? And of course, we, like pretty much everybody, we migrated all of our teams very quickly to working from home, to the virtual environment, quite a fundamental shift in terms of the workplace. And across all of our different locations, multiple locations in the Middle East, in Asia, in Europe, significant challenges. And of course, it started in China, didn't it? So we were able to learn from our colleagues in China in terms of some of the themes that they experienced and build those learnings as the pandemic sort of reached its sort of spread across the globe. So we were able to learn from our colleagues as we sort of managed that approach across other locations. Resilience has very much become the management and leadership buzzword of the year, rightly, because resilient organizations, resilient teams, resilient individuals, that's about how we're able to really support, empathize, coach, and work with our teams to be able to make sure that in turn we continue to support our clients, our members, and the patients that we actively support worldwide. So just moving on to our next slide, if that's possible. So focusing in again, sort of internally, what are the issues? And this is pretty practical stuff. Flexibility, time, how do I support my family? How do I balance the multiple competing demands of homeschooling, of setting up in virtual environments to work from home? How do we manage those types of things? And that's really important as an organization to really get that right, to communicate, to provide people with the right technology, the right equipment, to make sure that we've got the flexibility of, and I think, you know, what right at the start, Julia talked about it not being a policy issue, it's about sort of the way that we relate. Absolutely, this isn't about policy. So how we empathize, how we understand challenges, and how as organizations we respond to those challenges is a very human-centric thing. So of course, on occasions, it needs to be supported by policy. So one of the ones I was interested in is, are people taking time off this year for holidays, for vacations? And you know, we're all having conversations with people saying, why do I need to take time off and I can't travel? But actually focusing people back on, actually, it's really important to get that separation, to be able to build your personal resilience, to be able to look after yourself, whether you're in a management role or whether you're in a support role or a leadership role. Really important to take care of yourself, manage your own well-being, so that you're able to provide that same level of support to your teams. So that sort of self-care element of it is incredibly important too. Moving quickly on to the next slide, if that's possible. Culture. And I think, you know, we've heard this morning about different cultures and how we respond to different sort of regional differences here. And essentially, I work across the Middle East, as well as Europe and many other locations. So I see this on a daily basis, that responding to cultural nuances are critically important to be able to make sure that we've got the right response, that we're flexible, and that we don't have a sort of generic one-size-fits-all sort of corporate strategy. In effect, that we're able to make that real and relevant and local and very specific to the teams that we're working with. I would also say that culture is about leadership here. So making sure that we're able to really focus from the top on contribution rather than productivity. So people aren't sort of being held to maybe the typical sort of goals, standards that on other occasions in a different context would have been very much part of that management vocabulary. Very much the theme this year is on how you are as a person, rather than how are you doing from a performance perspective. So, of course, as managers and leaders, we still need to take tough decisions. We need to take commercial decisions. But how we do that has changed. How we do that now is as human to human, and how we relate. And there's a broader context. So you're thinking about the person, you're thinking about families, you're thinking about impact on communities, not just the sort of economic, rational, logical view that comes from an organizational sort of dynamic. So in doing that, we're able to build an empowered culture. So what's empowerment about? And again, another sort of management buzzword that we tend to sort of talk about on occasions. And for me, that this is about focus and attention. And this is difficult in a virtual world, isn't it? So here we are on a Zoom call, having some really in-depth and very insightful, I hope, conversations about how we relate to our teams and our colleagues. But is that as effective as if you can do it face to face? And that's, I think, is where we're challenged, isn't it? And you know, my take on this is that we're probably operating at something like 60% effectiveness in terms of those human to human interactions, those coaching conversations, those team conversations, those one-to-one critical check-ins. But keeping that culture alive from a leadership point of view, all important. And then just quickly moving on to our next slide, if that's possible. I think to summarize those themes, really the call to action this year in Cigna has been about evolving and changing how we work to make sure that we absolutely focus on supporting our people first and foremost. And doing that through how we connect. Empathy, listening, supporting, coaching, truly understanding. So the role of the manager, the role of the leader fundamentally changed. And as I mentioned right at the start, the employment relationship fundamentally changing from being an employee to being a human within that system. And a couple of other things just to talk about very briefly here. And if we just quickly have a look at the next slide, and some of the things that we're doing in Cigna, there's lots of detail on this, so there's no way I'm going to go through any of this. But equally, some of the things that other panel members have already talked about: mental health awareness, mental health first aid, coaching support, employee assistance programs, emergency time off. We've got wellness challenges, meditation sessions, and I really wanted to focus on check-ins with employees, check-ins not just about sort of, this is not a performance review. This is, how are you? It's a conversation, that manager to employee, that human to human, that team-based connectivity that's so important. Genuine care, genuine concern for the people that you work with. One of the things that we've found very powerful from a mental health, stress and anxiety perspective is to run a series of sort of open house conversations. We called them Cafe Hope sessions. They're nurse-led sessions, psychologically trained mental health nurses that run these kind of open house forums for teams to talk about and share their concerns and the issues that are challenging. And of course, where there are issues that come up that are particularly sort of challenging or personal, then being able to take those offline in a very confidential way. But from a team point of view, we've found that that's really been quite powerful. And I think if you take all of this sort of in summary, what we're doing here is we're embedding a set of behaviors that is not just about how you work and how you support your teams as leaders and managers, but it's why you do that. And you do that to become a human-centric, deeply caring, really focused on well-being first and foremost, in effect before the sort of economic, rational, organizational demands. So that well-being, that sense of looking after our people, absolutely all important. And we've done some research from a sort of global perspective too. And I think just quickly sort of having a look at the next slide, and I'm appreciating that I'm probably nearly out of time.
Yeah, you are,
Marianne. So I'm not going to go through any of this. This is there for you if you wanted to have a look at this. I think we can probably share these slides too. Quite a bit of research in terms of, we are in this for the long haul. So how do we really build that sort of resilience deeply in our teams to really move forward and to cope with this and to support each other, of course, longer term. And I think our final slide, which again, I'm not going to talk to, but just to show you, is again, that people are responding. There's a few sort of resources that really support this from a Cigna perspective that we can share, but really being able to sort of embed that sense of continuity, stability, career management, work-life balance. It comes back, as I said at the start, to that sort of fundamental leadership culture of support, enablement, and coaching.
Thanks so much, Robin.
Thank you.
I think having myself spent probably about the last 5 years thinking about well-being in the international development sector and creating spaces online for people to explore things together and support one another, there's been a real shift this year in terms of what's possible in terms of talking about well-being, talking about mental health, and also talking about some of the really challenging issues around power and privilege in our sector. And so in this time that's been, of course, a challenge for all of our mental health, I've also seen these seeds of real change in our practice that you've all spoken to in your different ways, from my own perspective as also a coach and a consultant and facilitator. So I'm excited for our discussion after the break, but we want to kind of model giving people a bit of space just to collect their thoughts and, get a drink or use the toilet, whatever you need to do. So we're going to take a 5-minute break. And during that break, so we'll come back at just at 13 minutes past 11 UK time. And we're going to put up another Mentimeter, so that the link will go in the chat for you. And it's, what's your key takeaway so far? What's your key takeaway from this discussion? So get yourself what you need, maybe do that first, and then come back and just share with us what's your key takeaway so far in the Mentimeter, and we'll get started again with a shared discussion at 13 minutes past. Thanks, everyone. What practical things can we do to explore and engage and embrace conversation so that approaches are not seen as or as Western imposed situations that don't fit? And Laura adds within that, I think there's an interesting conversation to be had about not being afraid to try or feeling shame around how we've been doing things in the past, this kind of idea of, we might have had good intentions potentially, but actually done more harm than good with interventions that weren't appropriate. And alongside that, there are a couple of other questions. So which I think I'm going to read them because I think we can answer them together as a group. We've created resources for wellbeing, but seen very little engagement from staff, almost none by staff in Africa. Any advice on ways to encourage this? That's one. And the other is the question from Dennis about, which was specifically to Lana, but I think others might want to take it as well. Considerations of local culture in deciding specifically how to source counselling services. and any data on the uptake of service as well, and particularly on higher risk staff in terms of gender, ethnicity, or LGBTQI, that you know, specific groups that might be more at risk or may struggle to take up service. There's a lot of questions, but I think they're all about context and take up in different ways, and how we approach kind of cultural humility, cultural sensitivity, but also provide wellbeing support. So I wanted to come maybe come to Julia first, because you think you raised it initially. I haven't heard from you for a while, but then I'll come to the others also on this.
Sure.
Yeah.
I think there's a couple of things that I just touch on. And the first one, really, let me, okay, so how do you make sure that your in inverted commas ideas about well-being are going to fit the group that, you know, you're hoping to support? I think what I found useful, and, you know, it's talk to your staff. It's talk to them, whether that's in focus groups, whether it's anonymous surveys, or a mixture of both, individual interviews with a range of staff. That's really critical, that, you know, you're not excluding, you know, the quiet voices, and making sure that you're talking to the working mums as well as the LBGT, and taking into account all the different factors that affect different people's well-being. So I think just starting by talking to people and finding out from them, really, that is the starting point, and from there you can build you know, services and that will hopefully go some way to supporting them. I think the other thing that I wanted to just touch on was, it's this last question about, you know, somebody's provided support for colleagues in Africa, but the take-up has been low. That's a really interesting one. I think there's a couple of things I'd say about that. The first is, you know, how much conversation went into the thought and the provision of those services. Are those services actually the right ones for that staff group? I think that takes you back to, have you talked to your staff, and have you really found out what they need? And it may be quite different to what you think. You know, it could be really practical stuff about working hours to enable mums to pick up the kids, or, you know, rather than necessarily the provision of a helpline. You know, not that either of those two things are you know, mutually exclusive, but so finding out what the provision is that people actually want. And then, you know, again, it's talking to staff about, depending on what those services are. I think somebody's mentioned it already, but the word stigma came up, and, you know, I think there is a lot of work to be done actually about destigmatizing talking about mental health, you know, or well-being, or whatever we want to call it, with staff who, it's in some cultures it's definitely a bit of a taboo, and still remains so. Less so in the Western context, but certainly it's not easy for other colleagues, and certainly nothing that we should take for granted, that they will, you know, want to put their hand up and say, I'm struggling. And there's all sorts of reasons for that, about, you know, hierarchies, who's going to know, will they be judged? And this, then, you know, it goes back to well-being being, you know, it's a cross-cutting issue. If you've got one part of the organization saying, tell us if you're struggling, and yet your line manager is going to judge you if you do sort of say you're struggling, then you've got a dilemma there. People aren't going to necessarily feel comfortable sharing. So those are two things. I'll leave it there, because I'm sure other people have got suggestions.
Thanks, Julia. Lana, do you want to pick up on the issue about take-up? Because I know you and I have talked about that a bit before.
Yes, thank you, Mary. I'm actually looking at the questions in the question box, and if I may, I have 3 questions that I would briefly answer. So regarding the counseling services depending on the context. So what we've done at IRC is we have a global, how you can do that, and it worked well at IRC, is we have a global network of counselors that are spread around almost every location where IRC works globally. So in the MENA region, for instance, when we want to provide a webinar on coping with the pandemic in the Libya context, when we brought a counselor, it was a counselor who speaks Arabic from the Middle East, who understands basically the context, who comes, she herself was coming from a background where she experienced emergencies and conflict in that sense. So I think bringing the appropriate and people who know the context and the context specific needs is also really important to optimize the support and for it to be more efficient. Also, what we found useful and we've developed on that is, at first the counseling services started to be offered in 26 languages. So we make sure that we accommodate almost every languages that are spoken within the IRC working areas. And staff would have the option to choose if they want to speak to choose the gender and the preference if they wish to speak to a male or female counselor. Because sometimes I would also, maybe this is a cultural thing or a context thing, maybe females would rather speak to female counselors and feel more comfortable and open and more open to speak to counselors when it comes about specific characteristics. And recently, staff have the option to choose the characteristic of the counselor they wish to speak to, the location, gender, female, male, LGBT, even characteristics, origin sometimes. So the IRC has tried to offer a vast variety of options to try to accommodate the different contexts and needs. We have, like, in our data, maybe I don't have all the data in front of me, but I can say that the most uptake was in the US and the MENA regions, were the highest regions of staff reaching out for support. And the topics that were trending a lot were emotional health and workplace stress. And it's interesting to see that always our female staff are more interested in this type of counseling, or we always have a higher female staff reaching out to the counseling services than the male. We do have male staff, but always the female were on a proceeding in that. People have regularly reached out to these sessions, and they've been having when the quota finishes of the sessions, they ask for more sessions. So obviously there's a need. There's a benefit from those sessions, and we are working on getting more and more numbers, but we also try to maintain confidentiality of those cases. And one more thing, sorry, I've taken maybe a lot of time, because I saw a question about considering having four days of working. So I think this is really great, and it's really important during these times when you're on lockdown. And one of the things that also IRC has offered to staff is something that's called COVID leave. So there are COVID-19 15 days leave that are offered to staff. They can take on half day or full day, and it's separate from their normal and sick leave days. So these are in case they are caregivers, they tested positive, they have someone in their family who tested positive they want to take care of, and if they have homeschooling and any other competing demands they want to make sure that they attend to. So I'm not sure if I'm answering. Yeah, so basically this is it from my side. I want to give the space for the others to answer as well. Thank you so much.
Thanks, Anna. Thank you. JD and Robin, do you have anything to add on the context-specific support? And
I mean, I think it's pretty much all been said here, but I would just absolutely reinforce the need for context-specific sort of resources. And also, I think the overarching theme here is don't presume to know what the answer is. And what we try to do is to get very close to our colleagues, to effectively really engage, really get to understand, really get to know how we can best then provide that level of support. And absolutely with counselling and coaching support and employee well-being that is specific and relevant to the region. And that's going to be very different for our teams in Africa, to our teams in the Middle East, and our teams in Europe. It's going to be very different across those different locations, for sure.
Thanks, Robin. Jodie, did you want to add?
I think everyone's answered the key points. I think the one thing that comes to mind is that it can take time. And I think, I don't think AFOD is there yet by any means. And I think I can see progress over the last 3 years in just having, like Julia said, having those conversations, trying to facilitate rather than lead, you know, get ideas from people, and yeah, step by step, it will progress. I think contextually, the support that's relevant will be reached.
Yeah. Thanks, Jodie. I've put a resource in the chat also, which is an article by Jessica Horn and an edition of the Gender and Development Journal that I co-edited early in the year. And I put it there because it looks at decolonising wellbeing and mental health support from an African feminist perspective, and it looks at different models of how we care for one another in community and collectively. And it's just, I think, a really interesting resource for thinking about expanding our idea of what wellbeing support could look like in different contexts. So I'm offering that there also. We're going to give you another Mentimeter as we talk. So it'd be great if we could have that, Lena, and just, what's your biggest challenge in your organisation? So we'd love to hear from you. What's your biggest challenge right now, and bring that into our discussion a bit here. So there's going to be a link hopefully shortly for you to, let me see if I've got it anyway. You got it, Lena? We're in the same document, getting the link. There it is. What's your biggest challenge in your organisation? So and as we wait for that to come up, just yeah, oh great, we've got some already. Getting buy-in for senior leaders. Yeah, got it. Supporting staff and supporting me. Yeah, that, and I think it's something that I can really attest to in my own work as well, that a lot of the people I work with have that challenge of how do we maintain supporting ourselves while supporting others is, I think, a big question in our work as people trying to create change in the world. And it's part of the reason why we opened with, you know, a reflection on some of the ways we support ourselves, because I think if we always have to be asking both questions, you know. I think I'm seeing senior leadership buy-in as a big question here. and inviting senior management to lead by example. And I wonder if any of our panelists might want to share any reflections on how they've engaged senior staff, or how senior staff have supported their work. I don't know if any of you want to come on. I can only see Robin right now because we're looking
can I in that case come in on this one, because I think we've had we've had some really interesting conversations over the course of this year. What I've seen our senior leaders across Cigna do is be very open to sharing their own concerns and their dilemmas, and I think that this plays to some of these themes. First of all, look after yourself. Focus on your own sense of well-being and be prepared to have those conversations. So, I mean, I think it's leading by example, and it's being the role model of that sort of cultural shift. So if you've got a leader that is prepared to very openly and very authentically talk about this struggle that they have, and they are the same struggles, aren't they, that we are all going through: homeschooling, mental health challenges, all of the things that we've been talking about today. Encourage managers, leaders to talk about those openly, act as role models. And that way, I think it kind of demystifies, it certainly helps. I'm not going to say it's an easy journey, but I think we've opened those conversations quite well.
Great, thanks, Robin.
If I may add something to that, I totally agree with Robin about the importance of being genuine and being vulnerable in front of your staff, because all of us are in this together. So if you have your leader who is, of course, hopefully communicating with staff on regular basis, because I believe that communication during these times is really important to stay connected. and during this communication to share their also concerns and their own struggles, and open the platform for others to share. It shows that we are all in this together. Senior leaders are not living on another planet, and it's good to share and hear from staff what they've been through. So I do agree with that, and I also agree. I also would like to add that having these regular check-ins that was mentioned also during this call, and making them lighthearted with a bit of humor, positivity, sometimes just happy hour with the coffee, work, just seeing each other and having these conversations outside of the crisis, outside of the of work, can sometimes also be really can come a long way for the well-being of staff. So yeah, just wanted to add that to what Robin said. Thank you.
Oh, thanks, Lana. There's more challenges coming up, so I think maybe let's yeah, I'm seeing a bit around funding and financial viability, and I think it's something that often comes up in discussions on well-being, like how do we resource this? And I hear often from people, you know, like funders don't want to fund this and that kind of thing. I wonder if any of you might want to bring insights on how you're resourcing what you're doing at the moment, and what the, you know, what you feel the challenges are around resourcing it. Maybe we take the Mentimeter down now, Lena, so we can see everyone. I can't see if anyone wants to talk.
Yeah. I've got a comment to make about funding. I think it's a really important point, and I'll go back to, I think, what I said at the beginning, right at the beginning, which is, you know, to embed staff well-being, it takes commitment, it takes senior leaders to buy into it and role model it, everything that people have talked about on this call. And it also takes some investment, and people, organizations, you know, have to put the money where the mouth is. You know, we just have to invest in it, and yeah, you know, it's difficult to, I think we're not used to justifying, you know, why staff well-being is so important. It seems like it's such a sort of a new concept in some weird way for many organizations. It's not something that they've had at the forefront of their minds as they would with a strategy document for the next 3 years in, you know, getting donor support or whatever. It's just not been talked about, and it's not been a priority. And I think there's, and I know, Anne-Marie, I know you'll know this, you know, over the years, things are slowly changing, but I do see a catalyst in the form of COVID in really, I mean, well-being has rocketed to the top of a lot of organizational agendas now. So there's a real opportunity to make a real link about staff well-being and performance of the organization. And I don't think there's enough data out there that can yet really support. I mean, there is actually lots of research out there, but it's not common knowledge really about the links between a happy staff and job retention. And we all know the recruitment costs are enormous, and the knock-on time that's wasted while we're, you know, looking for people to do jobs has a huge cost. Not just a financial one, but in terms of people's, you know, survival in some cases. So the funding question, it's a tricky one. I think we need to be better at making the argument in cogent terms that senior leaders can, you know, get off pat and really get their heads around about why it's not a luxury. It should be just normal practice and part of everybody's organizational sort of makeup, really. And so it's a bit of a conceptual shift. I think it's getting there. I think COVID has given us a real opportunity, but I'm just acknowledging it's difficult to, you know, to get people to put their hand in the pocket for a wellbeing advisor role, you know, for example. So that's my comment on that one.
I think it's really interesting because what I see as part of the conceptual shift is actually around people letting go of the idea that somehow what an aid worker is, and there are various people that write about this, Gemma Holdy being one of them, is this sort of like probably quite macho type person who goes into like, so, you know, like kind of superhuman person who actually, you know, it's just it's a like fix other people kind of a role. And actually, if we pay attention to people's well-being, it kind of messes with our idea of what is a humanitarian. There's this selfless kind of person who goes to save the world. Actually, no, that's not what humanitarian is. And as we know, it's much more messy work than that, much more complex, much more nuanced. And actually embracing this understanding of the needs we have as humanitarians, I think is part of understanding like shift, you know, how we can shift power and change the way we think about our sector. But it challenges this, you know, it challenges some ideas that are still out there, I think, in our, you know, which we might all have had at times, that somehow it's not about us. So because it's not about us, you know, caring for us is somehow not what we resource. And I think, you know, in some cases donors do understand that and are willing to support it. In other cases, it doesn't cost as much as maybe we kind of think it does, because as you said, there's so many costs associated with poor well-being, and there's so much evidence of that, not just in our sector, but in other sectors. I don't know if anyone else wants to come in on the funding. Robin, did you?
Well, I just wanted to mention that I think that if we look at well-being, we should be looking at it from a holistic point of view, and it's critically important to all of our organisations. From a cultural point of view, we talked a little bit about this before, but I think we can prove the economic argument here that healthy individuals, healthy teams, healthy organisations actually deliver, and in terms of sort of results and objectives, that's the way to do it. And I think there is a really strong economic kind of case behind that. Engaged employees, well employees, healthy teams makes a lot of sense. So I think there is quite a lot of research that really supports that perspective.
Yeah, for sure.
And so if I might just to build on that, and Robin, it'd be interesting to hear maybe your thoughts on this, but I'm intrigued to understand and to see beyond when this pandemic is over, for, you know, or we got to our new normal and we're coping with vaccines, etc. You know, the focus that has been put on well-being, you know, will there be a sort of a withdrawal? Will the well-being tide go back out again as a result of the pandemic coming to an end, or will we see this continue to be prioritized in organizations? Yeah. Because that's a really interesting question for me, and it's something that I don't know the answer to.
No, and it's such a relevant question. I mean, I genuinely think that this will have accelerated the move across all organizations globally to really value their people. And as part of that, valuing their people and supporting their people to really promote well-being and wellness. Absolutely. But equally, of course, there's a risk. There are many risks. And as we go to a much more sort of digitized way of operating across many of our different sort of sectors, then actually in turn that produces more challenges. It's great in terms of access to care and communication and fast, agile delivery, but there is a risk, of course, that you get a little bit further from your people. So how do you keep that sort of human element? But what it's done is it's put this debate center stage. And I think, you know, I mentioned this before, that I think that the sort of role of the HR leader, the role of the leader in organizations has actually transformed during this pandemic. And that's an opportunity for us, isn't it? To really take things that make a difference to our own organizations, to our teams, like well-being, and make sure that they continue to be top of the agenda going forward. I think they will.
Yeah, and for me, one of the things around that, you know, the potential distance of virtual working is actually how we support people to make online interactions more, if you like, people-centered and more, you know, more relationship building. I think there are ways and ways to communicate online, and they're not all equal, you know. So there is also, I think, a skill set there around how you have close relationships across distance and online, which I think for our sector is a real, you know, it's a real potential area for us to really think a lot about. There's a few questions that we kind of haven't really touched on, so I want to just pick them out, and then we're going to also share another Mentimeter. One of them is around matching mentors with mentors with coaches, or mentors with it's matching people with mentors and coaches. I think is the question. Is it something you outsource? Do you do it with whoever's locally available, wherever they're based? Aware of funding limitations of outsourcing, but would also love to build this in. Just to Jodie, maybe, I don't know if you, go ahead.
Yeah, I'll certainly share my experience so far about that. So when we started to review, to look at building on our mentoring program internally in CAFOD, I did work with an external consultant who was actually very clued up on mentoring and coaching and was a trained coach, and she helped me to get to grips with the way to bring it together, which was really helpful. And we reached out to all of CAFOD. We were very much kind of encouraging reverse mentoring. It's not just about leadership being the mentors. It depends on what the person wants to learn, and we looked for mentors internally and people who wanted to be mentors. And we did some training for them as well, and they're across kind of locations, and we also have some volunteers outside. So I'd say at the moment we have maybe around 15 to 20 mentors in CAFOD, and then we opened up and said, kind of actually at the same time we asked who would like to be mentored and why, so that people could have an idea of that. And so we were kind of trying to have a diverse range of mentors as possible and meet people's needs. And it's still kind of something that's building up and growing. In terms of mentor matching, we looked at this, and we are aware there's various different ways of doing that. You can get external providers to do it. We decided, and this is a 6-month pilot, we decided to do it in a self-matching way. So we have mentor profiles internally. People can read about the people and see what their skills are, experiences are. We support them as HR advisors, so we've all had a bit of training on that, to have a conversation and say, okay, have a look at these mentoring profiles. What do you think matches closely to what you're looking for? So it is a small project. It's not like there's loads of mentors, but we do it as a self-managing, self-mentoring, self-matching process.
Oh, great. Thank you. I want people to know that there's another Mentimeter up, and this is to sort of crowdsource, if you like, ideas within this group of people attending the webinar today. So what's your one tip for supporting staff well-being that you want to share with us all? We won't put it up on the screen quite yet. We'll do that in 5 or 10 minutes time. But you can be adding in your tip there, and we just want to, we thought it might be nice for people to share those. So great. Does anyone else want to add on matching or identifying coaches or mentors, that kind of support? Oh, no, we're good. Great. So where did I want to come to next? I think it'll be interesting to see the different tips you shared, and we've heard a lot from our panelists, but I think before we close, it'd be great to just to hear from our panelists if there's one additional tip or idea that they've recalled while we've been talking that they want to share before we close, or one additional reflection, just something relatively brief to close us. So who shall I come to first? Who's ready? Lana.
Can I before we go to the closing remarks, I just noticed that there was a question about gender, like if there are uptake data. So I don't have specific data now according to genders and the use of counseling, but we've had, like for instance, I would say in the Middle East, in 2000, so we do have, so each staff member have access to 6 counseling sessions per year per topic with unlimited number of topics. So each reach out is considered a case. So one person can take up to 6 or 12 sessions per year and be considered one case. So I just wanted to clarify that before I give like the numbers that we have. So in 2019, I would say in the Middle East and MENA region, we had 116 cases talking about emotional health and workplace stress related in general. And so when we're talking about cases, it can be different sessions. And now, from the beginning of the year up until now, we had 140 reach outs. And the reach outs were more about emotional health as well and stress during the pandemic. I don't have specific numbers, percentages right now, but I can say that, as I mentioned before, women have been reaching out more than men in the Middle East. But all in all, we have numbers according to regions. We don't even get numbers specifically for country programs at the moment, because this service is provided by a third party, and we try to maintain confidentiality around the cases, these characteristics. So just wanted to add this thing before we go into the remarks. And if anyone has any questions specifically about IRC, please feel free. I can share my email in the chat, and we can have more. I can share more in a discussion after the webinar because of the time. So just wanted to mention that. Thank you so much.
Thanks, Lana. Thank you. Yeah, so just inviting you all in a final remark, just to add anything on data if you've also got any, and also let us know where to find you if you want to be found. Who'd like to go first? Rob, to you, just because you're on the left of my screen, and I can go across.
Yeah, I think there was one comment I saw on the Mentimeter about sort of organisation change that I don't think we've really tackled, and I just wanted to come in briefly on that as a sort of thought. And I think it's more about communication, and we've talked about communication a lot, haven't we, in this session, and the need to get close to people and understand and listen, and to really be close to our colleagues. Organisations are not static, and I think that because we're in the middle of a global crisis, we can't just stand still. So change will still happen. Organizations will grow, they will change. On occasions, they will need to sort of reorganize and rationalize and things like that. We don't always have the answers, but I think it's really important here, again, from a leadership perspective, to take that sort of whole person health approach and really understand that in any organization decision, that it's the person that's important. And that's not just about sort of physical health or role security, it's about financial health, it's about mental health, all of these things that really contribute to this kind of whole person perspective. I think that's critically important in how we relate and how we communicate. I think the role of the manager, the people manager, in making sure that communication is absolutely front of mind in any change management and dealing with support through this year and going forward. So that I think would be my sort of final perspective. I think, again, absolutely, I'm really happy to engage with further conversations and questions and talk more about what we're doing at Cigna to support our own employees, and of course what we do to support organisations globally. Very happy to do that.
Thanks, Robin. I'm coming across to Julia. I'm just going in my order now.
I can pretty much say I think it's about listening, really listening to staff, and again, it's about the culture that you choose to adopt. With us, it's a people-centric approach, and that really, I think, we found it's worked really well in promoting flexibility of staff and their own resilience, whatever that might mean for them. So yeah, get to know your staff, talk to them, listen to them, and I think really importantly, where you can, and it's not always possible, but act to make the difference for them wherever you can. So that would be it. Yeah.
Thanks, Julia. Yeah, it's reminded me, and I just responded to someone, Jeff's point in the Q&A as well, that there's so much of this is about relationships and how we build them together, whether they're virtual, whether they're in person, but how we really think, how we treat each other, right? Lana.
Yeah, and in similar lines, I would say social support is really important, and communication and social support, whether in the workplace or outside of the workplace, connecting and being compassionate and empathetic, while either from a leader towards staff or even staff towards themselves and the circles around them. And also, just one last thing I want to mention, because we always say leaders, they need to do this and need to do that, and managers, they have a responsibility. I believe that leaders also, that I think it was mentioned here in the conversation, they need support and they need guidance from the organization, because we're all, again, in this together. So it's important also to prioritize supporting leaders who are supporting staff as well during these times. So I think this is really important as well.
Yeah, thanks, Anna. Thank you. JD.
Yeah, I think what strikes me as being really useful looking back in last year is just having working groups. So I think going back to what all of us were saying, talking to people, hearing what the key issues are, hearing what people think in the organization about what we should be doing to help address well-being. And I've found working groups kind of a helpful way of doing that. So
yeah, and again, that's about engagement, isn't it? It's about engaging more people in designing solutions so that they really meet everyone's needs. I'm just reflecting on the open question that we still have in the chat there from David, where he's talking about, I like the questions he asked at the end of it. What are we as organizations doing, almost always by accident, to annoy people and make their lives difficult? And it's kind of like, how can we be on the other side of that question? Ask what's annoying you and try and get it right. And where we're failing to respect things like time zones, religious rights, people's choice of location. And I also think about sort of language and other, there's so many issues in our sector around really putting people, the needs and preferences and of our people first in different contexts, which is obviously complex. And it's not as easy as just coming up with a wellbeing program from HQ, but actually that's what we've got to do. I think that's how we can make our places more people-centered and more positive for people's well-being. Let's go to the final Mentimeter. I don't know what's there because I have not looked at it yet. Here we go. One tip for supporting staff well-being, and others can add in if you haven't yet, but let's see. And feel free to add, add practical ideas as well as, whatever's in your mind as a final tip to share with all of us as we come towards the end of this webinar. Yeah, be vulnerable, ask how are you, listen to their needs, be open and listen. There's lots about that principle of really listening and understanding where people are at. As you continue to put things into that, I just want to bring us to a close and remind you that there are going to be 2 more webinars Bond and Signa are offering next year around wellbeing and international development sector. I think the themes for those will come out in due course. I want to thank all the speakers for being here with us today. I think that they can share how you can get in touch with them. They already have done. I'll also share mine. Also working a lot on these issues in different ways with people, so I'll put mine in there shortly too. And we've got an evaluation form, which I think there it is. Thanks, Una. So we'd love to know what you thought, and also what else you'd love to see from forthcoming webinars on wellbeing in the humanitarian sector or in international development in general from Bond. So please do add your feedback into that form. Yeah, and actually it's 5 minutes. We've got 5 minutes left. How did I manage that? If anyone's got an additional question that they wanted to ask and didn't have time for, do add it in for us. We'll stay here for the 5 minutes, but I've somehow managed to be so timely that you get a chance to like actually have a stretch, dance around your room, get yourself a cup of tea before what might be in your diary at midday. Thanks, Laura, for sharing that you loved the session. It's great to be here with you all today. Yeah, do add an additional question if you'd want to in the Q&A. We're still here, and let us know what you thought in the feedback form. Yeah. We can unmic, right? You want to unmute? I mean, unmic, unmute. Thank you all so much. And yeah, let's just stay and answer any questions that come up.
Sure. I'm impressed at the time management, Marianne.
I know.
Yeah, that was good.
It was slightly unusual. But I hope it just gives people a minute to before their next thing, because I know one thing that I found with this virtual working all the time, and I did it already before, but I do it even more now, is that somehow there manages to be another thing in your diary and there's isn't even the space to like go and have a stretch. So hopefully we've given people that makes me happy if you have.
That's good.
Yeah.
Yeah. Thanks everyone for being here. Yeah.
I thought there was some really interesting discussion there. I learned a lot.
Yeah, absolutely.
Really
Me too.
Me too.
Very informative. Yeah, thank you everyone for sharing your thoughts and experiences.
Yeah, and you.
It was super interesting how you know that you know you're all doing slightly different things, but this point about, and maybe it seems obvious, but I don't think it always is when organizations think, oh, how can I think about well-being? It's just really to ask people what they need. You know, that listening and engagement that you know you all brought in different ways to do that, which is really valuable, I think. But just to not assume that one size fits all, basically, right?
Yeah.
Definitely.
And you're right, it seems so obvious, but we just haven't you know, sometimes we haven't done that.
Yeah, I think often there's a sense that if we think about well-being as kind of a technical thing, we forget, you know, it's like, let's just kind of provide a service. But actually there's that input is really valuable in shaping what that service should be, right?
Yeah. I'm looking forward to reading that article, actually. I've just brought it up, the link. I'm going to read that right now, actually.
Right. Good. Oh, I didn't put my thing in the chat. I didn't put mine.
I think there's a question about how to engage men who would not naturally embrace counseling.
Oh, sorry.
Can I add quickly to that?
Please do.
Okay, so one of the things that that can be really helpful is to raise awareness about the importance of psychosocial support in general. Like you can come from it from a health perspective because of like the stress and burnout, how it can affect our health and like physically, our minds, our behaviors sometimes because of the stress. And yeah, this is something that's scientific basically. And sometimes we need to work a lot on raising awareness about how we normally take care of our body when we go to a doctor. We also need to take care of our mind and our emotions and our psychology in general. So I wouldn't say it's specifically for men. I would say raising awareness in general about the importance of counseling is really important. And it's not an easy job.
Can I add to that?
Please do.
Because it's a really good point. And I think what I found is useful is linking that support to better delivery for whatever your organization is delivering. If you can make the link between if you look after yourself, then you know we're going to be able to do a better job for the children, or you know, or whatever it is. Then that helps clarify in people's minds. It kind of almost gives them a good, you know, a get out to like, oh, I can see now why it's important, and there's almost a big, you know, a sense of why it's important that's beyond just themselves. And I think that sometimes makes it easier for them, some of those hard to reach people.
Yeah, absolutely. I think it's definitely, there's definitely something to be said for really thinking about different ways to engage men as well. I think, you know, it's obviously the case that in general it's easier to engage women in most contexts in this. I think just thinking, and again, it's probably a lot about talking to them too, you know, about what would support them to engage. Yeah. Thanks so much, everyone. We are actually at time now, and I think we've dealt with all the new questions. Yeah, thanks, David, for asking that. And someone's shared a resource there. So if you go in, if you're interested in how engaging men, there's a resource that someone's shared there in the questions that you can take a look at. And I think we'll close now. So thanks everyone for being here. This was like the slight after party for the last 5 minutes. But we've enjoyed it, and we'll hope to see you again for the next Bonn webinar on wellbeing in the new year.
Thanks, Marianne. You've done a fantastic job.